All right, guys, we went over the anatomy of the rotator cuff muscles, the function of the rotator cuff muscles. Now we are going to be going over the most commonly torn rotator cuff muscle / tendon, and what symptoms people sometimes experience when this happens. So when this muscle or tendon is torn, it can sometimes be a partial thickness tear, it can be a full thickness tear. Obviously, between the two, it's going to be a varying degree of symptoms. But when this happens, sometimes people experience pain at rest. You can even experience pain sometimes if you're lying down and you're lying on the affected shoulder. It might be more painful on that side to lay on that shoulder. Also, as we talked about before, supraspinatus is responsible for the first 15 degrees of abduction of the arms. So anytime you're rising your arms up above or trying to lower back down, that they both can cause pain. And sometimes during that lowering back down action, that can cause kind of like a catching sensation. That's actually one of the tests, a Codman drop arm test that sometimes physicians use to test for a supraspinatus tear. Another test that's used sometimes is the empty can test. So all you're going to do is pull your arms out to the side and you're going to turn your hand as if you're holding an empty can. And normally people, someone places pressure on the arm here, and then if there's pain or weakness that develops, usually that's a positive test. Other symptoms, you can have a deep ache or kind of like a stabbing sensation on the arm there. As far as who's at risk for this, obviously anybody who does repetitive motions, especially overhead motions, continually day after day. And maybe that's your job. Maybe you work as a painter or a plumber, something like that, where you're constantly using that muscle to raise your arm up above. Those things can place you at a higher risk for this condition. Yeah, that covers a lot of the basics.